care consultants at the Prince of Wales Hospital in Sydney, Australia. This is Katrine Gesper. She's one of the intensive care fellows. We're presenting to you today a novel way of managing acute severe life-threatening asthma. This lady presented on Christmas Day to our emergency department with a severe life-threatening asthma. Epinephrine is usually used in acute severe asthma as an infusion to produce maximal bronchodilation via its beta-2 agonist effect, and also by producing a reduction in airway swelling by its anti-inflammatory effect in combination with hydrocortisone. However, epinephrine in this situation may produce extreme tachycardia and hypertension and may impair the coronary blood flow, leading to untoward myocardial infarction. We have used a combination of epinephrine and dexmedetomidine, where epinephrine was given at a 0.1 microgram per kilo per minute, and dexmedetomidine was given without a loading dose at 0.6 micrograms per kilo per hour. The reason we've used dexmedetomidine is that dexmedetomidine will lead to a concomitant reduction in the norepinephrine level in the plasma, and also a reduction in heart rate, and also a reduction in blood pressure, which will cause a cardiovascular stability during an increasing dose of norepinephrine infusion.
So my name's Kim, I'm one of the other intensive care doctors here at Prince of Wales. I'm just going to go through with you this patient's pH and PCO2 from admission until current. These are two graphs of the patient's PCO2 and pH from admission until current. You can see that at admission both were grossly deranged, with a PCO2 of 168 and a pH of 6.82. An EpiDex infusion was started at admission, and this has resulted in a rapid decrease in bronchospasm and improvement in the PCO2 and pH rapidly over the first 8 hours, which has remained close to normal limits over the first 36 hours of admission, to the point at which the patient was extubated. Now we're going to look at trends for this patient's heart rate and blood pressure over the same period. Originally, the patient was in AF with a heart rate of 100 beats per minute. The EpiDex infusion has protected against additional tachycardia and hypertension throughout this period. Additionally, the patient this morning has reverted to a sinus rhythm with a baseline rate of 80 beats per minute.
As we presented to you, the use of EpiDex infusion in the setting of acute life-threatening asthma can be life-saving. We have replicated the use of EpiDex infusion in other patients with similar successful results. The use of EpiDex infusion should be considered early in the setting of acute life-threatening asthma. Thank you.